Welcome to this video presentation on gastroscopy examination of your stomach. We understand that medical procedures can sometimes feel overwhelming, but we're here to guide you through the process to help you feel more comfortable and informed about your upcoming gastroscopy. Hello, I am Dr. Maharaj, and I will be walking you through the consent process for your upcoming gastroscopy. A gastroscopy is a procedure where we use a thin, flexible tube with a camera called an endoscope to look inside the upper part of your digestive system. This includes your esophagus, the tube that carries food from your mouth to your stomach, and the duodenum, or the first part of your small intestine. We commonly perform gastroscopies to investigate symptoms such as heartburn or persistent acid reflux, stomach pain or discomfort, nausea or vomiting, food getting stuck or painful swallowing, anemia, which is having low iron stores or reduced blood count, unexplained weight loss, gluten allergies, diarrhea, and/or other upper GI symptoms. With this procedure, we can diagnose conditions like ulcers, inflammation, infections, and even tumors. In some cases, we may take small tissue samples called biopsies to check for infections like H. pylori, celiac disease, or other causes of inflammation. These biopsies are sent for examination by a pathologist later. The results will be available in about a few weeks. If there is something concerning, we will contact you. A copy of the results will be forwarded to your family doctor. Next time you see your doctor, confirm that the polyps or samples are of no immediate concern. When you arrive for your gastroscopy, we'll start by inserting a small plastic tube into your vein where we will inject the anesthesia later. Then we will attach oxygen and blood pressure monitors to your arm and fingertips to track your vital signs. You'll also receive oxygen through a tube placed just inside your nose. A plastic mouthguard will be placed between your teeth to protect them and to help guide the endoscope. You'll be lying on your left side, which provides the best view for us to examine your esophagus, stomach, and small intestine. A sedative will be given to help you relax and become drowsy and comfortable for about 10 minutes while we perform the procedure. Once you're sedated, I will gently pass the endoscope through your mouth, down your throat, and into your stomach. The endoscope allows us to closely examine the lining of these areas for any signs of abnormalities. The procedure itself usually takes about 5 to 10 minutes. If we find any abnormal areas, we may take small biopsies for further testing. Despite my best efforts to not hurt you, I may cause a complication to occur. While a gastroscopy is a safe procedure, it is essential to be aware of the potential complications and risks, or the likelihood of the complications occurring, as well the alternatives. Although rare complications may happen, which include a sore throat after the procedure, loose or chipped teeth from the insertion of the mouthguard and endoscope, very rarely minor bleeding, especially if biopsies are taken. If you vomit blood, you should seek medical help in the emergency department of your nearest hospital and call us immediately. Although exceedingly rare, there is a small increased risk of infection following a gastroscopy. Symptoms may include dizziness, fainting, lightheadedness, chest pain, and shortness of breath, or anything else of concern and out of the ordinary. Again, you should seek medical help in the emergency department and call us immediately. Very rarely, during the insertion of the camera internally, a tear or perforation in the esophagus, stomach lining, or in the duodenum, which is the upper part of the small intestine, particularly if the wall lining is thinned out and if we are trying to pass through an area of restriction or stenosis. We try to prevent this as much as possible. If it does happen, you may need further care in hospital, as you may become extremely sick without it. It's also important to mention that, as with other endoscopic procedures, air is gently introduced into your digestive tract during a gastroscopy to help improve visibility. This may cause temporary bloating, gas, or mild discomfort after the procedure, which should resolve on its own within a few hours. Although rare, there are potential risks associated with anesthesia or sedation, such as allergic reactions, difficulty breathing, or heart issues. It is important that you do not eat anything for at least 12 hours before the procedure to reduce the risk of anesthetic complications, especially breathing problems. Intravenous complications can also occur, which may include swelling, inflammation, bruising, blood clot, and infection. If you experience severe pain or unusual symptoms after the procedure, please contact us immediately or seek emergency care. If you decide not to undergo a gastroscopy, there are alternative methods of investigation, such as a series of X-rays or CT scans and CT or MR enterography. However, these alternatives are diagnostic only. No biopsies or treatments can be performed during these imaging studies, making it harder to diagnose and treat the cause of your symptoms. If a gastroscopy is recommended, it is often the most comprehensive way to diagnose conditions affecting your upper digestive tract. Before we proceed, it's essential that you understand the nature and purpose of the gastroscopy, the potential risks, and the alternatives available to you. You will also need to consent to the administration of anesthesia or sedation, which is necessary for your comfort during the procedure. Please remember to avoid driving, working, or being alone for the rest of the day after the procedure as you recover from the sedation. Please leave your valuables with a family member before the procedure. As we are a procedure-based practice and do our best in caring for all of our patients, ensuring everyone understands each procedure, has the opportunity to ask questions, and taking great care in performing each procedure, you may not be seen exactly at your scheduled time and may even be waiting for a few hours. We ask for your understanding and patience. When it is your turn, we will also do our best to give you high-quality care. Thus, please do not make plans for at least 6 hours after your procedure. You would likely be spending at least 2-3 hours in our clinic. Thank you for taking the time to watch this video and learn about your upcoming gastroscopy. If you have any further questions or concerns, please feel free to reach out to us. We're here to support you every step of the way, and remember, I'll get to the bottom of this, starting from the top. You will be asked for a code to verify that you have watched this video and understand it completely. Please write the code above EGD 924 in your consent form. Thank you.